Next is, Dr. Salil Kumar Mandal. Presenting author is Dr. Jeet Bhunia. The paper is about assessment of prevalence and risk factors for COVID associated mucormycosis, an observational audit.
Good morning, everyone. My topic, assessment of prevalence and risk factors for COVID-associated mucormycosis and observational audit. No financial interest in the study. Too much of personal comments without any scientific evidence portrayed by media creates ambiguity and confusion. This study intends to provide an understanding about the risk factors associated with mucormycosis. Introduction. Mucormycosis is a rare opportunistic fungal infection. Rhino-orbitocerebral mucormycosis (ROCM) is the most common clinical presentation of mucormycosis. Mode of infection: inhalation of fungal spores. Common associations: diabetes mellitus, corticosteroid therapy, immunosuppression, asthma, and chronic obstructive pulmonary disease. Aims and objectives: to establish the associated risk factors in CAM, to estimate the prevalence of risk factors in CAM cases. Material and methods: several parameters were chosen for their presence and subjected to statistical analysis to assess their influence as risk factors. Parameters included COVID-19 affection confirmed by RT-PCR report, cyclic threshold value and computed tomography severity score, diabetes mellitus from history, FBS and PPBS at the time of presentation, hypertension history, past use of steroids from old treatment records, past use of tocilizumab during COVID-19 treatment, past use of remdesivir and oxygen during COVID-19 treatment, past use of prolonged zinc supplementation and prolonged regular steam inhalation, conditions of already prevalent immunosuppressions, socio-economic status of the patient assessed as per modified Kupuswamy scale. The time period was from 1st March to 30th August of 2021. 83 numbers of diagnosed cases of ROCM were included in the study. Diagnosis was confirmed by endoscopic biopsy. This is a picture of the histological slide. Presence of all these parameters were confirmed not only by history taking but from old treatment records. A control group of 83 patients, age and sex matched, without ROCM but having diabetes mellitus and some of the other risk factors were included in this comparative study. These are some pictures of the patients while I was conducting this study. A master data chart of the patient particulars and all parameters was prepared. Prevalence of the parameters was extracted from the data pool. Comparative analysis with control group was done. Statistical significance was analyzed. Risk factors identified in this way. Coming to results, we had compared the gender distribution and the mean age group between the cases and the control, and the p-value was not significant. Coming to stage-wise distribution of ROCM, most of them were in the stage 2, that is orbital involvement, where stage 1 is involvement of nasal mucosa and sinuses, and stage 3 being the cerebral involvement. These are some pictures of the MRIs of the patients. This is a bar diagram showing the prevalence of the parameters among the cases and the controls. To explain this, we got, except in case of hypertension, all the other parameters were showing an odds ratio of more than 1, which implies a positive correlation. We had compared the mean FBS and the PPBS between the cases and the controls, and it was statistically significant in both the cases. Coming to socio-economic status, most of the cases were lying from the lower to the upper lower socio-economic strata, which when compared with the control group provided a significant value, which was highly significant. Comparing the cyclic threshold value and the mean computed tomography severity score between the cases and the control yielded no significant value. Discussion: not much data are available about the rise of mucormycosis cases due to lack of evidence-based studies and the rarity of the disease. Prior history of the following were found to have positive correlation with the prevalence of ROCM, which are history of RT-PCR proven COVID-19 infection, poorer socio-economic status, history of steroid therapy, requirement of oxygen therapy, history of remdesivir and tocilizumab intake, poor glycemic control, prolonged period of steam inhalation, prolonged zinc supplementation. We had compared our findings with that of available literature and found agreement in cases of COVID-19 affection confirmed by RT-PCR report, diabetes mellitus, past use of steroid, past use of oxygen during the COVID-19 treatment. All these showed a positive correlation which was going in accordance with the previous studies. To conclude, further analysis with larger sample size is required to supplement the present study in order to validate these positive correlations as possible risk factors for CAM. In the present scenario, with increasing incidence of CAM being reported every day, the findings of the present study might aid in prevention and early detection of CAM among the susceptible populations. These are my references. Thank you.
Any questions from panel?
What is the role of supplementation?
Sorry.
The role of zinc supplementation for prolonged period?
Zinc supplementation?
Yeah.
So, this is for the the zinc supplementation is used for the COVID-19 treatment, and it was found to be a risk factor for the mucormycosis. Like it was found to be a risk factor, and it was used for the patients, and they presented with mucormycosis. And the zinc supplementation, these patients were taking for more than around 3 months, like continuous zinc supplementation, even after the cessation of the COVID-19 disease treatment.
I don't know, not very much proved studies are there.
Yes, sir, it was the previous studies doesn't agree with that.
Yeah, thank you.
Okay. Did you find any correlation with dental problem and mucormycosis? Because we in our study, many patients had these dental issues who developed orbital mucormycosis.
I did find, but I found only in 2 patients. I didn't include that in the study.
That is surprising because we had to train our dental department for that, to detect the cases and send immediately to ENT and ophthalm department. Okay, thank you. Sir, your question?
It was fantastic, good study. You've seen most of the factors which are associated with it and good statistical analysis. Thank you.
Thank you.